Peggy Lavin is an Director of Behavioral Health for the Accreditation Guru. While with the Joint Commission, Peggy was actively involved with Maryland's Behavioral Health Administration, licensing, and PRP providers for required accreditation for obtaining a behavioral health license.
Hi, Joyce. Thanks for inviting me to join you.
We welcome you. Let's start with Peggy. Peggy, you were in the thick of things while at the Joint Commission, actively involved with the Maryland BH Administration licensing and PRP providers for required accreditation for obtaining a BH license. Is Maryland unique with that requirement?
Well, Joyce, saying in the thick of things is a good description for the frequent communication and collaboration between the state of Maryland, the accrediting bodies, and the providers, as Maryland converted from their old license certification processes to the current community-based behavioral health license. It was a pretty active time, and it took many years. So it started with Maryland thinking about what they wanted, what their expectations were, and the different models, and then a lot of dialogue with the accrediting bodies who were interested in being approved. At that time, I worked for the Joint Commission, and we, at the Joint Commission, as well as the other accrediting bodies, needed to take a look and explain our survey process and our standards to the state of Maryland to make sure that they were compatible with their expectations, where they wanted to get to in terms of this license. And that took some time. And then once approved, all the accrediting bodies worked very hard and very closely with the providers, including the Psychiatric Rehabilitation Program providers in Maryland, to get accredited. They had to be accredited, I think it was by January of 2018, in order to apply for the license, the new license, which was effective April of 2018. You asked if it was unique, so I'm going to get to that specific question. It is considered an accreditation-based license, and that means that in order to provide psychiatric rehabilitation programs and services in Maryland, you have to have a license. And in order to get the license, you have to be accredited. So it's an accreditation-based license. This is unique in that the state of Maryland's degree of reliance on the accrediting body for both quality of care and providing a safe service delivery is very unique. It's probably the strongest state accreditation mandated license that I'm aware of. If it's not the top, it's certainly in the top 3, but I think it might be the strongest.
So let's set the stage a bit further. What accrediting bodies are approved for PRP providers?
Good question. So there are 4 approved accrediting bodies for the PHP providers in Maryland. That would be CARF International, the Joint Commission, and it's the Joint Commission's Behavioral Healthcare Accreditation Program that is approved for the psychiatric rehabilitation providers. The Council on Accreditation, which is commonly called COA, or goes by its acronym COA. And the 4th approved body is the Accreditation Commission for Health Care, again, commonly known by its acronym ACHC. On the Maryland website, there are actually charts that for each of those 4 accrediting bodies. And on the left side, they list the Medicaid reimbursed program or service, and to the right, they talk about what crosswalk to the accrediting body's category of services and standards. So it gives you a guide as to what standards apply. And on each of these 4 charts, the 3 psychiatric rehabilitation services are listed: the Psychiatric Rehabilitation Program for adults, Psychiatric Rehabilitation Program for minors, and the Residential Psychiatric Rehabilitation Program.
And
So
what
we
is
have four, right now we have four approved accrediting bodies, short answer.
yeah. What is the key message to licensed PRP providers? What would you share with them?
So a licensed PRP provider means that they're already accredited. They've gone through the initial accreditation preparation, maybe have gone through a reaccreditation, and they are now accredited and licensed to provide PRP services. I would say two things. One is that when you are awarded accreditation, that provider is committing to operate in continuous compliance with all applicable standards. So they go into the maintenance mode. They have to operate in compliance at all times, not just during the survey. Second, I would say that, and many of the providers on the call probably know this, accreditation is awarded for a period of time. It's not forever. And so there's a renewal, a reaccreditation process. And that can be 1 year, 3 years, or 4 years, depending on which accrediting body you have selected and the type of accreditation award that accrediting body has given you. So when you're coming up for renewal, there is the reaccreditation preparation. I would say that if you do well during the maintenance mode, you operate in compliance with applicable standards, it's a lighter lift for the reaccreditation survey than it was for the initial accreditation survey. But during that period of time, you do need to be aware of any new or revised standards. If you change your operations, you have to, one, make sure that you have reflected that change in your written plans, policies, and procedures, and that it's still in compliance with the applicable standard or standards. So maintenance mode and be prepared for reaccreditation, two key messages.
And how does a provider meet the accreditation requirement to obtain the license to operate?
So in order to operate, you have to be accredited. To be fully accredited, you have to be providing services, PRP services to individuals. So in order to provide services, you have to be accredited. So in order to avoid that dilemma, all four accrediting bodies have what I call a two-step process. So an initial provider would be required to go through this two-step process. So the first step is an initial survey that is looking at compliance with a subset of the applicable standards. And if you demonstrate compliance, you are awarded a temporary accreditation. With that temporary accreditation, you can then apply for your license, get your license, start providing services, and then within a period of time, and it's usually within 6 months, the provider needs to go to the second step, which is to have a second survey, and it's what we call a full survey, looking at compliance with all applicable standards, and at that point, they can be fully accredited. And again, as I said previously, that would last for a year, 3 years, 4 years, depending on their accrediting body.
And do you have any experience that once they do get licensed and operating in Maryland, providing those PRP services, how easy it is for them to bill on that provider portal?
I don't have direct experience, but I hear things. I hear things from providers. And what I hear is that accreditation and the billing process complement each other. So that accreditation requires certain clinical case management activities, on-site, off-site visits, different services are required and documented. Accreditation is big on documentation. So that providing those activities and documenting fuels the billing system. And the billing system complements accreditation because it prompts the provider to do these activities at the right frequency, make sure it's documented correctly, so on and so forth. And of course, people say to me all the time that effective and efficient reimbursement is a key factor in the health of their organization. And so, any system that supports accreditation, because they have to be accredited, and gives them an efficient and effective billing system, promotes good health for the organization.